It's not picking up. Oh, it says we're live. Hello, everyone. Hello, everyone in out there in social media land. We are going to do a very special stream this morning. We're going to talk all about pneumonia and the importance of getting the pneumonia vaccine. So I'm going to welcome Rohini and Dr. Casey Coffey, and we're going to start talking about pneumonia. And perhaps the first thing we really need to do is define what pneumonia is. Many people might have an idea of what pneumonia is, but it may not be accurate. So, good morning. And who would like to start and define pneumonia?
Good morning. I think I'll take that first question because I think it's important to understand when we're talking about pneumonia, there are lots of different types. So pneumonia itself is just a lung infection that causes severe coughing, often a fever, and can make you have some trouble breathing. But pneumonia can be caused by viruses such as COVID or influenza, bacteria, and even sometimes rarely fungi. So when we're talking about pneumonia, we're talking about the syndrome of a lung infection with those symptoms. But different types of pneumonia have different treatments and different routes of prevention.
So tell me, I hear the terms, you said pneumonia could be caused by a bug. What's the difference between pneumonia and bronchitis? I mean, they're both lung issues. Can bronchitis lead to pneumonia?
Yeah, that's a great question. So bronchitis is an infection or inflammation of the airways that lead into the lungs. So occasionally an infection of the airways that go into the lungs can lead to that deeper infection. But similarly, an infection of the airways, bronchitis, can be caused by viruses or bacteria. So in that way, it's similar. The itis is just telling you where the inflammation is. So bronchitis, inflammation of the bronchi or the airways.
And so how do we treat pneumonia?
Well, it depends on what causes the pneumonia. So if you have a viral pneumonia, you're going to treat pneumonia with an antiviral medication. So you may be familiar with this. If you had pneumonia due to COVID or pneumonia due to flu, you can be given an antiviral medication. A lot of times if pneumonia is caused by a virus, there isn't much we do except help to treat the symptoms. So something that helps treat your cough or reduces your fever just until you get to feeling better. If you have a bacterial pneumonia, that's the time when we'll give you something like an antibiotic to target those bacteria that cause pneumonia. And similarly, in the rare case of a fungal pneumonia, we're going to give you an antifungal medication.
So you talked about three different pneumonias. What are the symptoms for each of these pneumonias the same, or are they different?
Pretty much they're going to be the same. So it can be very difficult to tell if you're the one experiencing the symptoms, what type of pneumonia you have. So if you come to an urgent care or an emergency department, or even your primary care physician's office, we can do different tests to determine, is this more likely to be a viral pneumonia? Is this more likely to be a bacterial pneumonia? And those tests will help guide the treatment.
So what do we do to treat and then possibly prevent pneumonia?
Well, as has been said, an ounce of prevention is worth a pound of cure. So there is a pneumonia vaccine that can help protect against bacterial pneumonia. So just like we have a COVID vaccine that protects against COVID, a flu vaccine that protects against flu, there's a vaccine that protects against bacterial pneumonia caused by the most common bacteria to cause pneumonia.
So let's talk about that vaccine. How often is it administered? Is it an every year thing like COVID or flu? So let's talk about the importance and who should take that vaccine.
So I can jump in here and take some of those questions. So unlike the influenza vaccine, and now it's becoming more common to get multiple doses of the COVID vaccine, it's not something you get every year. The pneumococcal vaccine is recommended for children less than 5, anybody greater than age 50, and anybody between the ages of 19 and 49 that has certain chronic conditions. So that includes patients with weakened immune systems, patients with chronic liver, renal, kidney disease, and diabetes. And those are just a few of those examples. The exact type and the number of vaccines you will need really depends on your age and your history of previous vaccines. So I encourage everyone to really talk to their healthcare providers to see if they need any more doses to complete their series.
So, how can veterans know when they, like, who gives them the vaccine? Can they get it here at the VA? So how do veterans access that vaccine?
That's a great question. Yes, we do have the pneumococcal vaccines available for our veterans, and I would say to reach out to your primary care providers, and they will be able to get you that vaccine, and you can get it in clinic.
Any side effects?
So, like most pneumococcal vaccines are generally well tolerated. Occasionally, some patients may have some mild redness or soreness at the site of injection. You might feel a little bit tired, a mild fever or headache, but these symptoms usually resolve in 1 or 2 days.
Okay, so now that we, have the vaccine, let's say you're over 50, you're a veteran, you're over 50, and you might have anything from asthma to COPD, and you get your vaccine for the bacterial version of so does that mean that people are still at risk for the viral and the other, the fungal versions of pneumonia?
Yeah, that's a great question. And just remember that each vaccine can only protect against the organism, the virus, or the bacteria to which it's targeted. So COVID doesn't protect you from flu, right? The COVID vaccine protects you from COVID. The influenza vaccine protects you from influenza. And the pneumococcal, that's the bacteria that causes bacterial pneumonia, protects you against that bacterial pneumonia.
So without the vaccine, can pneumonia be fatal? Or is it, how detrimental would it be if people who maybe were afraid of vaccines, or maybe who think they're getting many vaccines because they have flu and COVID to get, can pneumonia be fatal?
Absolutely. So that's one of the scary things about bacterial illnesses is they can progress and progress rather rapidly. Most people who get pneumonia would feel sick for several days and then start to get better on their own. But there are certain groups, and those are the groups that are targeted for this vaccine, those under the age of 5 and those over the age of 50, and then especially over the age of 65, are more at risk for severe disease. And certainly if you have an immune compromising condition or other comorbidities, you can get more severe disease. So again, that's the reason why we recommend vaccines, so that we don't have those severe types of infections.
So the takeaways would be to call your primary care provider and ask for a vaccine, or to schedule it for your next visit.
Yep, I would say if you're over the age of 50, check with your doctor and make sure that you've had at least one pneumonia vaccine. Depending on what type you've had previously, they may recommend that you get another one. We have developed newer vaccines that protect against more of these bacteria. And once you get the most updated vaccine, most people are good for the rest of their lives.
So can you talk about the new vaccine development? You said that, I thought pneumococcal might be just one bacteria, but is that a family of bacteria? So what do you mean when you talk about the updated vaccines?
Yeah, that's a great question. So unlike viruses, which mutate and change very quickly, where we have to give new vaccines every year, bacteria tend to mutate or change more slowly, but they do change. And so under the umbrella of pneumococcal pneumonia, or you may hear the term streptococcal pneumonia, this is all one family, but there can be different branches on that family tree. And as we discover more of them or new ones that can cause disease, we update those vaccines. And so you may notice that the vaccines have a number after them. So we have like the PCV20 and the PCV21. That number tells you all the different types of pneumonia that it protects against.
So maybe you might not know this. I might have to get this information from someone else. But if a veteran wants to get that vaccine, can they also get it through, I know that we are able to give, or to make sure that veterans can receive their COVID and flu shots at a community partner. Is it the same for vaccine? I mean, for pneumonia vaccine. Do you know?
I do not know the answer to that.
Well, I will find the answer to that, and I'll put
That's
it in the comments.
Great question, though.
Yeah, I mean, because if veterans are able to get flu and endemic, vaccinations for free, at the community level. I'll check in and see if they can get it for free at the community level. So what are the 3 most important things you want veterans to know about pneumonia and about the vaccine that they could take away from this chat this morning?
I would say that pneumonia is a serious disease, but it is preventable. Please check with your primary care physician to make sure that you have had your pneumonia vaccines and to make sure that you don't need any new vaccinations. And I'll close by saying that an ounce of prevention is worth a pound of cure.
Well, that says it all. An ounce of prevention is worth a pound of cure. As we were chatting this morning, I happened to remember that the Muppet, Jim Henson, the Muppet creator, did perish from pneumonia. That's how he passed. So,
and actually 2 days ago was World Pneumonia Day. So this is a timely interview.
Okay. So we hope that at least everyone listening this morning, or even if you view it later this afternoon, check with your PCP to make sure you have your vaccine. If you don't, make an appointment and get your vaccine, and let's keep all of our veterans on a good path to wellness. Thank you, Dr. Rohini and Dr. Coffey. We're going to sign off for now. Thank you.
Thank you. Bye.
Have a great day.